Local programming on KRWG made possible in part by viewers like you. Thank you.
Welcome to Fronteras, a Changing America. I'm Edmundo Resendez. On today's Fronteras, we take a look at addiction and mental health. Idea Stream's Lucia Bushak takes a look at a local Ohio program that aims to stem those rising foster care numbers by helping pregnant women suffering from addiction get into treatment and stay with their children.
He's such a big boy.
Yeah.
At her home in Berea, 24-year-old Heather Minista catches up with Vivette Evans, who has become her mentor and friend. During the 5 years Minista struggled with a heroin addiction, she overdosed 12 times.
I went straight to shooting it. The first time I ever tried heroin, I shot it. I guess death didn't really scare me. I was just doing whatever, you know. And then I found out I was pregnant, and that's when everything changed. Better.
To keep her newborn from going into foster care, Minista had to get sober. She was able to get help through Child Welfare Services, which paired her with Evans and an innovative program known as START, and has since been in recovery. In Cuyahoga County, the START program aims to help pregnant women or women with young children in the child welfare system who are struggling with substance abuse to get into treatment. There are some 472 families involved in the program. Mothers are referred to START through Child Services. The pathway to that referral often starts because they're reported to Child Services for a suspected child abuse or neglect, or they test positive for drugs while pregnant. Other mothers like Minista ask for help themselves.
What are you doing?
The goal is to keep families together and to stem the skyrocketing rates of children going into foster care due to the opioid epidemic.
A friend won't give you drugs.
Perhaps the most innovative aspect of the program is the Family Advocacy or Peer Mentor program. Family advocates like Evans are recovering addicts themselves and paired with the parent as a mentor to help walk them through treatment.
At a young age, I was introduced to alcohol. From that point, I became a follower. I got into taking pills, then I started with the crack cocaine. The alcohol was always present. And that's what almost ended my life.
Evans got sober in 2004 and has been clean for 14 years. Since becoming a family advocate 4 years ago, she's been able to use her own experience with addiction to help others.
When they look at you and say, okay, well, you've been where I'm at, so you get it. They don't open up a lot of times to the worker because they're ashamed or they feel that someone's going to look down upon them. But I always tell them, I'm reaching my hand out to pull you up because I've been there.
Family advocates like Evans visit their clients at home, provide transportation when needed, or accompany them to appointments or drug court, all with the goal of getting them clean and reunited with their kids.
The role of that person within this program is to walk with the parent through their recovery process, through the child welfare process, and say, hey, I was where you were, I know what you're going through, I got through it, and you can too. And that really seems to be kind of the game changer within this program. It makes the difference.
Fawn Goodell is the director of the START pilot program at PCSAO in Columbus, an advocacy organization for child welfare in Ohio. The START program has been in Cuyahoga County for over 2 decades, and in 2017, the state expanded the program to 16 southern Ohio counties.
Right now we're concentrating on getting these 16 counties up and running and going, but in the next few years we would like to see this program expand to other counties that are interested.
The new expanded program in Ohio also borrows from a successful model in Kentucky. Research has shown that the Kentucky program has kept more people in recovery.
For moms that enroll and start, they become sober at twice the rate as moms that do not. Kids are half as likely to enter into foster care as those that do not. And for every $1 that they spend on Kentucky Start, they are saving $2.22 in placement costs. So we believe that this is going to hopefully have very similar results here in Ohio.
Good job.
Meanwhile, back at her home in Berea, Heather Minista feels confident and excited about her new life and is now expecting her second child. Manista will stay with the STAR program as well as be paired with a caseworker from Child Services again in an effort to stay clean and maintain custody of her kids. As for Vivette Evans, being able to walk beside her clients as they get to recovery is always a positive moment for her.
Recovery is beautiful. It really is. That's why recovery I think of as like a butterfly. When that butterfly emerges from its cocoon, it's so beautiful.
Ready, set, woo!
For Manista, recovery means the chance to rebuild a new life with her soon-to-be daughter and her son Colton, who is now 16 months old.
My biggest fears is him hating me for what I've done in my past. So I want to correct it and teach him, like, yes, I have done this in the past, but mommy's better now. Mommy's in recovery. Mommy's doing this stuff, and I have to keep doing it. It's an everyday thing, and I'm fighting not only for myself, but for him too.
NAMIWalks is having a local event in El Paso on September 22nd. NAMIWalks is the largest and most successful mental health awareness and fundraising event in the country. Isidro Torres is Outreach and Fundraising Coordinator with NAMI in El Paso. He is our guest on today's Fronteras. Isidro, welcome to Fronteras.
Edmundo, thank you for having me.
Let's talk about NAMI, N-A-M-I. What does it stand for, and this is a national organization?
Yes, NAMI is the National Alliance on Mental Illness, and so we provide advocacy, education, support to those living with mental health conditions and their families.
There is a NAMI chapter in Las Cruces, and there's a chapter in El Paso. Tell me about the El Paso chapter. When did it get its start, and what does it primarily focus on?
So NAMI El Paso has been in the El Paso community since 1986, and so we started with a group of families who came together in local hospitals there in El Paso and decided that they wanted to have more resources and have a group for family members and those living with mental health conditions so that they can improve lives, spread awareness in El Paso, and eliminate the stigma surrounding El Paso.
Talk to me about mental health awareness in El Paso. How prevalent is it, and what about stigma?
So mental health is prevalent in the country with 1 in 5 U.S. adults
living with U.S. adults
living with a mental health condition in a given year. And so El Paso, we see that number 1 in 4, so that number increases. And so it's very prevalent, especially in a community where we'll see individuals such as immigrants not reporting due to in fear of reporting. So it's very prevalent in our community, and we definitely see a lot of times family members or individuals have a hard time looking for resources and have a hard time with the waiting times to get to those resources. And so we're there to help connect people to those resources and give them some support and education in that time where they have to wait to get them.
Latinos in El Paso in particular, many of them are first generation or second generation, and they come from a country or an area where mental health is not as prevalent or it's not discussed as much. And they come into the United States in El Paso and may be suffering from mental health. How do you go about educating those recent immigrants, getting the word out to them about offering NAMI as a resource?
So one of the biggest barriers we see with those first gen is that there's a language barrier. So their English isn't that well, and they rather communicate in Spanish. So what NAMI El Paso does, and what a lot of NAMI chapters across the nation do, is they provide that education and that support in Spanish so that they can better understand it and they can get the information that they need.
What is the state of mental health in El Paso? Are there enough psychiatrists, psychologists, therapists in El Paso? Are there enough organizations, nonprofit organizations, to help out some of these folks?
It's hard to say if there's enough because of how prevalent mental health is and how many people live with mental health conditions. El Paso, we do have a wide variety of resources and organizations to help, but the need is just so big that a lot of organizations see, again, a lot of wait time and a lot of backup before they can actually see those individuals who need that help. But as we move along, it's been a priority of the community where a lot of members, a lot of organizations and a lot of agencies in the community have come together, have formed collaboratives and consortiums where mental health is the #1 priority, and we can make sure we can improve access to mental health services in El Paso.
How do you go about with parents of kids with mental health, children that are just growing up and might start to show signs that they are afflicted with a mental health illness, and with parents who may not know that their child is suffering from mental health illness. How do you go about reaching out to these parents through schools and through other organizations to reach out to them?
Yeah, so definitely one way of improving mental health access and mental health care in the community is by educating prevention and intervention. So NAMI offers some programs such as NAMI Parents, Teachers as Allies, where it's a group of individuals who have experience with mental health conditions and have experience being a parent, a teacher, or a young adult. And they go out into the community, give a presentation to give parents and teachers the tools they need to be able to identify a student that is at risk or could be living with the mental health condition, and where they can send them so that they can get the help they need. We also have a course for parents or caregivers of young adults or adolescents who are living with mental health conditions, so that we can give them the strategies so that they can act as advocates for those that they're caring for, and they can better understand mental health. And so through these, the important thing is educating prevention, intervention, and making sure that the stigma that surrounds mental health is removed, so that way we can ensure that people get the help they need without fear.
Let's talk about, are there mental health hospitals in El Paso? There's one in Las Cruces, Mesilla Valley Hospital. Are there any hospitals in El Paso that deal strictly with mental health?
Yes, so we have a couple of hospitals. We have the El Paso Psychiatric Center, we have El Paso Behavioral Health Systems, and we also have the local mental health authority in El Paso that offers outpatient services, which is Emergence Health Network, and one a little drive away is Peak Behavioral, which is located in Santa Teresa.
Full disclosure, my wife works for Mesilla Valley Hospital, so I'm very aware of some of the mental health issues, and one of the challenges is, again, reaching out to communities that might not have the financial resources, because some of these are private hospitals. Are there enough resources to reach out people that cannot afford to go seek mental health?
From our experiences, we do see that problem, and it's hard to connect them to those resources where they're able to get that financial help. The help is there, it's just a matter of looking for it, but there's definitely not
But how frustrating is it for a parent that, again, might be new to the country, might not speak the language, and to have somebody going through a mental health crisis not know where to seek help?
It's definitely very difficult, and it's definitely very frustrating. And in the community, we have to do our best to help those individuals, because that is such an at-risk population. And it's so frustrating, it's so difficult. But with the education that we can offer, we hope to make that easier for everybody. And we hope that, again, our mission is to make sure that there's no stigma surrounding mental health, so that there is no fear and there is no misunderstanding of what mental health is, because again, there's also so many myths, there's so many incorrect facts going around, or incorrect statements going around.
Well, I'll give you some of the myths that
Right.
I've grown up with. Is growing up, you have people that suffer from mental health that cure it by abusing alcohol,
Right.
or maybe abusing drugs, or you have some family members saying, "Ta loco, leave him alone."
Right.
He's just a little bit crazy, just leave him alone and ignore it.
Right.
You have those kind of stigmas and those myths. How do you help overcome those? And I know that's part of the mission that NAMI has.
Right. The most important thing to overcome that stigma is to provide education, because a lot of it comes from not understanding exactly what a mental health condition is, how it comes about, and how it can be treated. Because a person is not defined by their mental health condition, they just happen to live with the mental health condition. Like any other ailment or illnesses we might have as human beings, that's exactly what a mental health condition is, and it is treatable, and there's hope, and that's one of the big messages we try to give out. And so to overcome that stigma, we provide that hope, and we try to find that hope, and again, we educate. This is what a mental health condition is. It's not a big deal. Well, for a lot, it could be a big deal, but it's definitely a big deal, but it's not something that we can't treat, and it's not something that we can't overcome.
Let's talk about some of the programs that NAMI El Paso offers. You offer the peer-to-peer program, NAMI Connection, ask the doctor and in our own voice, plus the one you mentioned earlier, parents and teachers as allies. What do some of these programs do?
They, first and foremost, again, it always goes back to the education. They educate these people. And it also gives people a place to interact with those who have experiences. So all of these programs are led by volunteers, and these volunteers have lived experiences, and they're trained to either give these presentations or to give these courses. And so when you're a family member, when you're an individual, and you're going through that crisis and you're going through that episode, it's always good to have someone there that helps you, that lets you know that you're not alone. And many people have been through this, and again, we can get through this together, and we'll help you find strategies, we'll give you the information about what mental health is, we'll lead you to resources, and so that's the overarching goal of all these programs. Some of these programs are geared towards family members, because when an individual has a mental health condition, it not only affects them, but it definitely affects the family. And so it's important we also give the families those tools to be able to cope with that and to be able to help their loved one that's living with the mental health condition. NAMI Peer-to-Peer is one of our newer programs in NAMI El Paso that's really geared towards those who are living with a mental health condition or believe they're living with a mental health condition. And so we try to help them better understand. We try to help them give them the terminology, because there's so much terminology, there's so much information, a lot of acronyms, and so we help them navigate that so it can be easier on them. And we try to eliminate as much stress as possible, because it is very stressful. And again, we help them towards that living a full life in recovery.
Let's talk about NAMI itself. Do you have monthly meetings? Do you have weekly meetings? How often do you get together? And what kind of outreach do you do to invite people that might just be discovering the world of mental health to get involved with NAMI?
Right, so one of the things that we offer weekly is support groups. So we have 2 different support groups happening at El Paso Behavioral Health System in their outpatient area. We have a family support group for family members and a peer support group for those living with mental health conditions. And these are going on every Monday. We just had Memorial Day, and they were still there from 7 to 9 p.m. So they're there holidays, they're there every Monday to help people and give them that resource. We also have our classes periodically throughout the year, and we offer them throughout El Paso, not only in one location. So we're trying to increase access to those who don't have easy access to transportation. And so you'll find NAMI El Paso in a lot of the health fairs that are happening in around El Paso, just so that we can have that touch with that community, and we can communicate the information we have, and we can communicate the resources we have, and we're always a call away as well.
Let's talk about your big event. It's coming up on, September 22nd, and it's NAMIWalks. It's celebrating its 16th anniversary. What is NAMIWalks?
NAMIWalks is a 5K walk where we bring together all walks of life, everybody from professionals, family members, advocates, allies, and you come together, walk to fight and end that stigma surrounding mental health and bring awareness to mental health. So we're always excited for this event, and it's also our biggest fundraising event that helps us continue to offer our free education support.
That's key, is that the services you offer are free.
Yeah, they are free. And we offer them both in English and in Spanish.
So where does the event take place? Where does it take place? You said it's 5K walk. Who's invited and who attends? How many people have attended in the past?
So it'll be September 22nd again at Memorial Park Reserve. Check-in is at 8:30 in the morning, and the walk starts at 9:30. It's on a Saturday, and so we're always fortunate to have nice weather. Last year we had over 500 people attend, which is one of our biggest walks yet. And so we invite the entire community to come together, have some fun. After the walk is over, we come back to Memorial Park Reserve. We have some activities, we have entertainment, we have raffle prizes, and we just come together and celebrate the end of stigma that surrounds mental health. And we again come together and we just bring a positive platform where we can talk about mental health.
Let's talk about NAMI being a nonprofit organization. What are some of your greatest needs that you have? You mentioned that this is a big fundraiser for you.
So, a lot of the classes, what we do is we provide, again, free resources. And so we're always looking for funding to be able to provide all that printed material. And we're always looking for volunteers to help us teach those classes. And so we have a base of probably over 100 volunteers that we have that we can go out and ask, hey, can you help us? Can you teach this class? And so being in the nonprofit, again, always the biggest thing is that funding. And so that's what we're always looking for. And so that's key.
What kind of training does NAMI El Paso offer to mental health professionals, to police departments, to different organizations that might not be too aware of mental health and how they can offer mental health services through their programs?
Yeah, so just this week we trained our first cohort of presenters for one program, NAMI Provider. What NAMI Provider is an in-house training, or we can spread it out in 4 hours or 5 weeks, and we go in-house and we teach professionals or mental health professionals, give them the perspective of the individual living with mental health conditions. Because a lot of these individuals go to training and they're learning all this information, but it's very important to give them the perspective of that individual who has that experience. And so that's what NAMI Provider does. And NAMI El Paso is so lucky to also be part of the curriculum for crisis intervention training for the El Paso Police Department, in collaboration with Emergency Health Network and the police department, to train a group of police officers who know how to deal with individuals that are in crisis. So we're hoping soon that the El Paso Police Department will have their own team that know, how to deal with individuals who have a mental health condition and make sure we get them to the right resources. And so we're working on that, and we hope to be rolling that out soon.
What kind of other partners do you work with to bring about mental health awareness?
So we work with a bunch of organizations such as Emergency Health Network, El Paso Behavioral Health. We work with other local organizations such as Family Service of El Paso, Paso del Norte Health Foundation, to, again, meet collaboratively and work with these organizations for all of our events, so that way we can bring awareness.
Let's briefly talk again about stigma as we wrap up this show. What are some stigmas around mental health, looking at different generations of people in our communities, how they go about facing these stigmas and how to help overcome them? What priorities do you put when you go out talking in different organizations about overcoming stigmas?
So a lot of the stigma is fear. It's not knowing what's happening. It's worried what people will think of them. The stigma also comes from some of the headlines we see after a lot of these tragic incidents are happening in schools around our country, where they're putting the blame on mental health conditions. And so all of this comes together and it creates this stigma of people not wanting to seek help, and wanting to keep it a secret and keeping it within. So our priority is to let them know, again, that there's help, there's people out here, there's resources to help you and make sure that you can live a full life, and not be worried about what people are thinking about you, and not have fear of any retaliation or anything just because you have a mental health condition. And so we're working towards that. We're constantly working towards that, and we're definitely seeing big strides in our community in improving that.
Aside from this big fundraiser happening on September 22nd, NAMIWalks, what are the resources, what other places do you get financial support from?
We are funded through a big grant from the Paso del Norte Health Foundation that helps fund a lot of the programs. We also receive help from the El Paso Community Foundation, and we receive generous donations from donors all across El Paso throughout the year. And we also receive a lot of our funding from our membership. So we have 3 different membership tiers where people can become members of NAMI El Paso, NAMI Texas, and NAMI National, where they receive monthly newsletters, where they receive quarterly newsletters and information about what's going on. And so all of these stuff helps us continue our mission.
What challenges does NAMI face? We're in 2018, half the year is almost over. What challenges do you face and that you want to see overcome in the upcoming years?
I think we want to see more resources in the community. We want to see more mental health professionals and providers in the community of El Paso that understand that, that borderland culture, that Hispanic culture, and be able to provide culturally competent services. We also want to see more services in our community that help, eliminate that fear of seeking help, and to be more accessible to those individuals.
Are universities providing enough students to go into the mental health field, to get into organizations to help work in hospitals that deal with mental health?
I think so, and I think we're seeing, universities like NMSU, UTEP, Texas Tech in El Paso. We are definitely seeing a lot of individuals being educated, but one of the big problems we see is that they tend to go out of the city, and that's a problem that definitely needs to be addressed. But we know that those mental health professionals are out there, and we encourage people who are interested in mental health to go into the mental health field, because there's definitely a big need in helping fight the stigma and give people those resources.
Once again, let's talk about the event, September 22nd. Where and how can people learn more about it?
People can register for free and learn more about it at NAMIWalks.org/El Paso.
Okay, I want to thank you very much, Isidro, for joining us.
Thank you so
on
much for having
Fronteras. NAMIWalks takes place on September 22nd in El Paso. To learn more about the event, visit NAMI, NAMIEP.org. I'm Edmundo Resendez. Thank you for joining us.